Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today's topic is epilepsy, a neurologic disorder that affects millions globally and can impact every aspect of a person's life. Joining me today is Dr. Bryn Henderson, an expert in regenerative medicine. Today, we'll explore epilepsy's causes, diagnosis, treatment options, and groundbreaking advances in therapy, giving new hope to patients. Let's begin with the basics, Dr. Henderson. What is epilepsy?
Epilepsy is a chronic neurological disorder characterized by recurrent, unprovoked seizures. These seizures are caused by abnormal, excessive neurological activity in the brain. Epilepsy can present in many forms, ranging from brief lapses in awareness to full body convulsions, where the back gets rigid and people swing their arms. The condition can begin at any age and may stem from genetic, structural, metabolic, or unknown causes.
Is epilepsy inherited?
Absolutely. Genetics play a crucial role in many forms of epilepsy. For example, generalized epilepsies often have a strong heredity component, sometimes linked to mutations in our genes or neurotransmitter systems. Modern genetic testing, including next-generation sequencing, can now help identify mutations, particularly in children with early onset or treatment-resistant seizures in epilepsy.
All right, so before birth, can early brain development play a role?
Yes, problems with how the brain forms before birth can sometimes cause epilepsy. For example, certain areas of the brain may not develop in the usual way, which can make them more likely to trigger seizures. Things like a lack of oxygen, infections during pregnancy, or poor growth before birth can also affect brain development and increase the risk of epilepsy.
What does traditional Chinese medicine do for epilepsy?
In traditional Chinese medicine, epilepsy is viewed through the lens of imbalances. We're out of balance, particularly involving wind, phlegm, and deficiencies in the liver or kidneys. Acupuncture, herbal formulations, in the traditional Chinese medicine are widely used in China. Studies that show that combining acupuncture with anti-seizure medications improve seizure control and quality of life. But treatment should always be individualized and supervised.
All right, let's talk about diagnosis. How do doctors diagnose epilepsy today?
Diagnosis is clinical. It's supported by electroencephalograms and neuroimaging. A good history distinguishing seizures is key. EEG, that's the electroencephalogram, confirms epileptic activity, and MRI helps at times to identify structural causes like tumors or malformations. Seizures must be unprovoked and recurrent to meet the definition of epilepsy.
All right, so someone's been diagnosed with epilepsy, and now the doctor's going to put them on some kind of treatment. What are the main treatment options in our standard of care for epilepsy today?
The mainstream is pharmacological. It's anti-seizure medicines. They have a whole bunch of big names. About 60 to 70% of the people achieve control with the medications alone. For drug-resistant cases, surgery or vagal nerve stimulation, and maybe a ketogenic diet are the newer therapies that may be needed. The treatment is tailored to seizure type, patient age, comorbidities, that's other illnesses, and reproductive considerations.
Okay, so you mentioned dietary changes for epilepsy. What is a ketogenic diet?
Great question. You hear about that all the time, don't we? The ketogenic diet is a way of eating foods that are high in fat and low in carbs. This makes the body and the brain switch from using sugar for energy into using special substances called ketones. hence the name keto diet. Ketones can help calm overactive brain cells and making the seizures less likely. The diet may also reduce inflammation, protect brain cells, and even change gut bacteria in ways that help prevent the seizures. It's been especially helpful in some hard to treat types of epilepsy, including childhood syndromes, which can cut seizures in half or more. It's not for everyone, and it needs to be done under medical supervision to avoid side effects or nutritional problems. But for the right patient, it can make a big difference.
Tell me about the advances in regenerative medicine that you use in your office.
Yes, we're very lucky. It's such an exciting field. The preclinical studies showed that regenerative cells can modulate the cellular excitability. Exosomes are vesicles that carry anti-inflammatory, and they're getting more frequent utilization, especially for drug-resistant epilepsy.
All right. One of the things you use a lot in your office are peptides. Can peptides help?
Peptides absolutely help because they're neuroprotective. They're like targeting adenosine or GABA receptors. That can reduce seizure activity. These are just proteins, Peptides are made from amino acids. So now you've got peptide-based neurotropic agents. For example, cerebrolysine. It's shown potential benefits in seizure recovery, cognitive support, and it's extremely beneficial with very few, if any, side effects.
You do a lot of neurofeedback training in your office. How does it work exactly for those who have heard the word but don't know exactly how it's done?
You're correct. We do it quite a bit because neurofeedback, or electroencephalogram biofeedback, trains patients to regulate their own brain waves and helps them increase the activity per conduit or nerve conduct. It's non-invasive. It's very helpful for focal epilepsy or when medications cause side effects. The meta-analysis show it can reduce seizure frequency by up to 50% in some patients, especially when used consistently.
So what about lifestyle? What can patients do to support the fact that they don't want to have seizures and they know what their triggers are? What are some of the support things that they could do for themselves?
Very strong fundamental things can be done to absolutely impact these patients and their families' lives. Get regular sleep on a schedule usually, and manage your stress, noting what is the trigger early. Avoid alcohol and any known triggers. Eat a balanced, low glycemic or ketogenic diet, if advised, and be cautious with other over-the-counter meds. Some decongestants, pain relievers like tramadol, and antihistamines, they lower the seizure threshold. Keeping a seizure diary is very important and helps build support at home. These diaries can play a key role in the quality of your life.
All right. So an epileptic patient has to come to the doctor's office how often?
It depends upon their age, it depends upon how they get there, but initially every 1 to 3 months until they're stable. Then every 6 to 12 months. We monitor some of them teleconsulting-wise and monitor their seizure control. The drug levels, if they're required, they're taken in a lab because we're trying to minimize side effects and improve mental health. Follow-up is especially critical when you're tapering or modifying medications. And of course, what we're trying to do is avoid surgical intervention unless it's the only option. The regenerative options almost always give us some hope.
I know you have a mnemonic for recognizing epilepsy care. What is it called?
Well, it won't surprise you. The word is SEIZE, SEIZE.
So the S is for?
Seizure Diary.
E.
Education for patients and families.
I.
Imaging and electroencephalogram.
C.
0 missed meds.
E.
Evaluate regularly. It helps clinicians and patients stay on track with their epilepsy care.
Well, thank you, Dr. Henderson, for being with us today and explaining epilepsy as a lifelong challenge, but one that with modern medications, personalized care, and promising regenerative therapies, there is hope. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.